Now, do I give that to everybody? No, but depending on what other problems you have, and depending if you do have depression or anxiety, those medications can be very helpful. And that would include, I don't know if anyone's heard here of Cymbalta. Cymbalta is a newer medication that's come out, and Cymbalta is not particularly indicated for depression. However, its mechanism of action is the same as Cymbalta, so one could infer, but again, you can't assume, that it would be helpful for treatment of depression, and it is used in Europe to treat depression. So if I have a patient who has both depression and fibromyalgia, and they're on, let's say, Lexapro, well then, generally, I will discontinue the Lexapro and start either Cymbalta or Cymbalta, because then you sort of get a 2-for-1. You have one medication instead of adding another one and now having two, and you're treating 2 or even 3 diagnoses: depression, anxiety, and the fibromyalgia pain. So that's one way I kind of look at it. There's also other medications that are not necessarily approved for fibromyalgia that I also use that are also in the antidepressant category, such as Wellbutrin. That's not necessarily helpful for pain, but it can be helpful for giving you a little bit more energy if you also have concurrent depression. And so again, depending on what else is going on, you have to tailor things properly for a particular patient. Also, there's other what's called tricyclic antidepressants, such as amitriptyline, and I don't know if anyone's heard of cyclobenzaprine or Flexeril. That's in the muscle relaxant category, but actually it works as a tricyclic antidepressant and helps when taken in the evenings with that restorative sleep. And again, not everything's for everybody, but these antidepressants can be combined under a doctor's supervision, and you can try to tweak things so that you're getting proper pain relief, but also restorative sleep. There's also the other medication that is approved for fibromyalgia is Lyrica, and I tend to start really slowly with this medication. So even though the package says to start with a certain dose and start it twice a day, I start it extremely low, gives samples so that you're able to try it out. 1 dose at night, and then you can build up over a few days to a week, and then you increase it gradually, because I think that starting low and going slow is better than overdoing it at the beginning. And again, depends on the person. Sometimes it's very effective, and sometimes it doesn't work at all, and sometimes you have side effects, so it really depends on the person. In the office, I do also do trigger point injections, and this has lidocaine and cortisone in it. So lidocaine is a numbing agent, cortisone is an anti-inflammatory, and obviously if your whole entire body hurts, you don't want to do every single point, but sometimes you're having a flare and it's really severe, and there's certain spots that are really tense, and the trigger point injections can be very helpful in those situations to get you through that flare. Is that, it's a Band-Aid, of course, but I mean, that's what everything is. I mean, ultimately, the sleep and exercise, you're going to go back to that. But in between, you want to have tools that you can use, to kind of get through things. So some other tools would be, there's a Lidoderm patch, and again, I'm not speaking for any companies, that's not approved for fibromyalgia per se, but the Lidoderm patch, again, lidocaine is a numbing agent, so it comes in a patch form, and what's nice about it is it doesn't have side effects, it doesn't have drug interactions. And it is only approved for what's called post-herpetic neuralgia, so if you've had shingles. But if you can get it approved, then it can be very helpful for pain, and you can put the patch on where it hurts, and you can wear several patches at a time, and so that there's another tool that you have at your disposal. You're having a flare today in your right shoulder, well, you slap on a patch on your right shoulder and you go on with your day. There's also a medication called Tramadol or Ultram. This is not an anti-inflammatory, but it's not a narcotic. And I do like this medication because I try not, if I don't have to, use narcotics, but I find that the anti-inflammatories don't really work. So this is another medication that can be either taken as needed or taken regularly, depending on the situation. Because sometimes if you have pain all the time, why are you taking something as needed. Well, then you need something every day. Right, so take it every day. So, you know, a lot of people are resistant to, oh, I don't want to take any pills. Well, then you're going to suffer with the pain. You need to break that cycle of the pain and bring that down, and so you're able to exercise and sleep. So again, Tramadol is another tool that I use, and it comes in short-acting and long-acting, and again, depending on your situation, what dose and whatnot. Nuvigil and Provigil, these are medications that actually are stimulants. I try not to use too much of them because it's almost like taking caffeine, it's amphetamines. And so there is potential, because you are speeding up your nervous system. First of all, your anxiety could get worse. That's for sure. It also can make you more irritable, and it'll give you some energy, but there is some question whether or not it can increase your risk of heart disease, because again, it's almost like speed, it's speeding you up, so could it increase your risk of heart disease or stroke? And so I try not to use that unless really there's excessive daytime sleepiness associated with fibromyalgia and depression. So, you know, that depends on the person. Combination therapy, I find, so they say in rheumatoid arthritis, a different disease, but they say combination therapy works better than any single agent alone. And they've done studies proving that. Well, they haven't done any studies like that in fibromyalgia. All the studies are patients who are on one medicine, only one medicine. In reality, that's not the patients who I see. I mean, maybe I'm also seeing a specialized group of people, I don't know. But most of the people I see are on more than one medication. I find combination therapy works better than one alone. But I don't usually start more than one thing at the same time. Well, if something's going to work, how do you know which one it was? If something's not working, how do you know which one? And if something gives you a side effect, well, how do you know which one it was there? So I usually start one thing, reevaluate, increase it, decrease it, or add something then at that point, because really it becomes too confusing and frustrating for everybody. There are also some alternative treatments, and I don't know if anyone's interested in hearing a little bit about that. First of all, diet. There have actually been no studies that prove that diet has any relationship to pain, except maybe omega-3s, such as fish oil, for inflammation. Now, technically, fibromyalgia is not an inflammatory disease. However, there's really no harm in taking omega-3s. Therefore, if you eat a lot of fish oil or fatty fish, it might help with pain, and there's really no harm in taking it. So I say, just like glucosamine chondroitin, there's really no harm. It may not help you, but certainly there's no harm in taking it. Acupuncture, and I didn't realize we were going to have an acupuncturist, but acupuncture actually, like exercise, releases endorphins. And you probably know a lot more than I do, but it's hard to do studies with acupuncture because you need to want to have a placebo group. Placebo meaning you don't know which one you're getting. Well, sham acupuncture, meaning it actually is not true acupuncture, has sometimes worked. And so it's really tricky to do studies with both, and it's hard to find people who are willing to get needles that are not necessarily acupuncture. However, it has shown to be effective in fibromyalgia, migraines, osteoarthritis of the knees, as well as chronic low back pain. So, and I'm an evidence person, and I don't recommend things unless I see the evidence to back it, and there is evidence for acupuncture for fibromyalgia. The problem is insurance coverage, or lack of, and so, obviously you can discuss that, and I don't know if you have any cards out? Okay, great, thank you.